are going to look at the management of the CIN, that is the cervical intraepithelial neoplasia. So to begin with the questions, the first question will be, how do you handle the class 1? The second question we want to ask is, how do you manage the class 3? So in this video, we will find the answers to these questions and learn in detail about this topic. To begin with, we look at the class 1. So what is this class 1? Class 1 is nothing but it is the regular pap smear screening. So you do the regular pap smear screening. And then we look at the class 2. So what happens in the class 2? It is nothing but inflammatory. Class 2 is inflammatory. So what does this do? This basically it treats the infection. It treats the infection and you repeat the pap smear every 3 months. So there is repeat of the pap smear every 3 months. And so there are two outcomes of this. So either it can be normal or there can be the persistent regular smear. There is a persistent repeat smear. So in terms of normal, it can be, that is the regular pap smear screening. It is the regular pap smear screen. And in terms of the persistent repeat smear, we do the colposcopy, as well as the biopsy. So under this, we again what we do is we treat as LSIL or the HSIL. Now next, moving ahead, we look at the class 3. So what happens in class 3? In terms of class 3, there is the LSIL. There is LSIL. So what is LSIL? LSIL is the CIN1. So here what is done is there is a code test which is done yearly. Code test. The code test is done yearly. And there are two outcomes, that it can be normal or it can be persisting after 2 years. So it can be present after 2 years. So they are the two outcomes. So in case it is normal, there is a regular pap smear screening. So this a regular pap smear screening. So this is what happens. And then when you look at the, which is persists after 2 years. So here we look for the colposcopy as well as the biopsy. And here we also look for the, what is done is a cryoablation as well as the laser ablation. Then moving ahead, the class 4. The class 4, here it includes the HSIL. The HSIL, that is the CIN2 and 3. So here what is done is the colposcopy and the biopsy. So the colposcopy and the biopsy. Then this, it can be normal as well as it can be abnormal. So in terms of normal, we do the endocervical curettage. And in case of abnormal, what is done? In case of abnormal, the surgical excision with the LEEP, LEEP or the LLETZ. Then we move on to the stage 5. So what happens in stage 5 is that it is known as invasive carcinoma. And in case of invasive carcinoma, that includes the biopsy. And there's also the treat. So we treat according to the stage. Now we'll be answering our questions. So the first question we saw was, what happens in stage 1? Class 1 is basically, it is normal. So there is the regular pap smear and the screening is done. The second question he asked was, what is class 3? So class 3 is nothing but the CIN1. And here we do the co-test. Co-test is done yearly. So once the co-test is done yearly, we have two possibilities. One is that it is normal, and the other is you can persist for 2 years. These are the two things. So in terms of normal, you regulate the pap smear screening. So you do a regular pap smear screen. So this is done. We do this in case of normal. So what if it persists over 2 years? So we do the colposcopy and the biopsy. So here there is cryoablation and also the laser ablation. Now to check your level of understanding, we have some bonus questions. So you can answer these bonus questions in the comments. So the questions we want to ask is, firstly, what is class 2? The class 2 management of the CIN. And the next question we want to ask is, what is the class 4? The class 4 of the CIN classification management.